If you're in no shape to work, as in, say, the flu, or it's just a common cold even, you know, there's always one day during a common cold when you just are not in any shape to work. Now, most restaurant managers, owners, they would have you come in, you know, and if they can't find anybody to work for you, they're, you know, dude, I need you here, you gotta be here. And I've done it, you know, you gotta come in, you gotta go in, you take your medication, but when you think about it, it's a restaurant, you're serving food. If you've got the flu or a cold, you don't want your server there, because eventually everyone's going to get sick. It just runs its course, you know. You can bust through a common cold. You can even bust through the flu, you know, and other people may or may not get sick. It can be done. It's not fun. However, if you were to like break your arm, break your leg, gosh. You know, I've never had that happen to me. I've had it happen to coworkers, and to be honest, I've never given it much thought. Like, what are they doing for money?
I have never worked in a service industry job where I had health insurance. There have been offerings of some kind of program where you pay into it a certain amount, and sometimes it can be lessened than if you were just your own autonomous person going and getting health care for yourself. So I've been offered sort of group rates that were never good enough for me to want to take, were never cheap enough for me to afford.
I've never had health care through a restaurant employer. I've either had my own health care through school or under my parents. I've been really fortunate that I've never been really sick in the case of having to be hospitalized. I do worry about it now that I'm getting a little bit older, and I've done this for 6 years, so I'm starting to think more of opportunities where I could get health care. And that would most likely either a change in the overall industry where they provide it for their workers, or finding a job. So it's definitely something that I think everyone starts to think about.
I mean, I recently just cracked a rib, and I thought about it. What if I really hurt myself? What would I do for work? And you know, I probably would get a loan from mom and dad, but a lot of people don't have that option.
I had such severe tendinitis that I woke up one morning and I couldn't close my hand, open or close my hand, and so obviously I couldn't exactly be slinging drinks all night long. And I had to call, initially I called my co-worker, who was unfortunately the only other bartender, and he was out of town. And then so I called my boss and didn't really know what to do because it was only myself or the other one. We ended up having to have someone from one of his other restaurants come over and whatever. But there was basically, I was out for a week, no pay whatsoever, even though it could have potentially been a workman's comp, maybe. But overall, you are left with, you know, you basically have to just try to find your own way to cover yourself. You know, I mean, that's always first priority, is when you get sick, it is your responsibility to cover yourself.
I know that even a doctor's visit, if you miss a shift, to ensure that you have a job when you come back, you have to have a doctor's note, and to have a doctor's note, you have to pay at least $250 to go to Quick Care, and that's the cheapest you're going to find. And the other places is $500 or more for one visit to get a doctor's note. So I know that people have showed up for work sick when they should have been in the hospital, but because to go in the hospital they would be missing out on a shift's wage, and also they'd be paying $300 to go and get a doctor's note.
If we are taking care of ourselves before our customers, then you don't usually get to keep your job, and you definitely don't make any money.